Cervical rib can cause something called thoracic outlet syndrome. This includes compression of the lower trunk of the brachial plexus. So, by the way, we'll talk very briefly about what the brachial plexus is. The roots of the lower trunk are C8 and T1, and we'll identify that thoracic outlet syndrome, which can be caused by cervical rib, can entail atrophy of the intrinsic muscles of the hand, namely the lumbricals, the interossei, the thenar muscles, and the hypothenar muscles. And then we'll add as a distinct cause or contributor to the thoracic outlet syndrome something else called a Pancoast tumor, which simply put is a tumor, more specifically a carcinoma, at the apex of the lung. The vast majority of people are born with 12 pairs of ribs. They are numbered from top to bottom, so the first normally refers to the topmost rib. However, it is possible to have a cervical rib, an extra rib that forms above the first rib. The brachial plexus has an upper trunk, a middle trunk, and a lower trunk. But we haven't mentioned what is the brachial plexus. Brachial just means related to the arm, and plexus refers here to a network of nerves. So the brachial plexus is a network of nerves in the shoulder so that the spinal cord can tell the arms and hands what to do, and the arms and hands can let the spinal cord know how they're feeling and what they're feeling. What actually are these trunks of the brachial plexus? Well, we said their names already. By the way, the upper trunk can also be called the superior trunk, and the lower can be called inferior, of course. To understand what these brachial plexus trunks, these three trunks, actually are, we have to take a step back and talk about the roots of the brachial plexus. So the anterior primary rami of spinal nerves C5, C6, C7, C8, and T1 are these 5 roots that make the start of the brachial plexus. As these roots pass between the anterior and middle scalene muscles of the neck, C5 and C6 are joined to make the upper trunk. C7 stays alone to make the middle trunk, and C8 and T1 join to make the lower trunk. I'll repeat myself here and say that for our purposes, we should know that C5 through T1 are the roots of the brachial plexus, and C5 and C6 make the upper trunk, C7 makes the middle trunk, and C8 and T1 make the lower trunk. A moment ago, we mentioned passing between the anterior and middle scalene muscles of the neck. This spot is within an anatomical triangle called the scalene triangle, or a name I like better here is the interscalene triangle. When we look at a picture of these 3 trunks passing through this interscalene triangle, we can see it looks a bit snug, and that the subclavian artery also likes to get through here. So that's the point. If we have this extra cervical rib above the first rib, it makes it more snug. And the one that tends to suffer from the compression is the lower trunk, and also the subclavian vessels. This is what we're talking about when we say thoracic outlet syndrome. The blood vessels or nerves in the space between your collarbone and your first rib, which we can call this space the thoracic outlet, they get compressed. This is usually at the scalene triangle, which is bound by the anterior and middle scalene muscles with the first rib at the base. The muscle deficit that arises as part of this syndrome is atrophy of the intrinsic hand muscles, the lumbricals, interossei, thenar, and hypothenar. Here let's mention some starter items to know about each of these groups. First off, these fist knuckles here are the MCP joints. Why MCP? The Carpals, the C, are these 8 little bones that, along with the distal edge of the 2 forearm bones, comprise the wrist. And distal to those carpals are the metacarpals, which are long, although because of your palm and your backhand skin, you can't really see their elongated shape. Then the phalanges are the actual finger bones. So the MCP joint is a joint between MC and P, that is between metacarpals and phalanges. You could think of the metacarpals as palm bones, I guess, and the phalanges as they are actually the finger bones. So job number 1 of the lumbricals is flex at the MCP joint. Job number 2 of the lumbricals is straighten out the distal part of the fingers. We said that the phalanges are the finger bones, but we didn't mention that each finger has 3 phalanges, except the thumb, which has only 2. The joints between one phalanx and the next phalanx are the interphalangeal joints, and since there are 2 such joints in each finger except the thumb, we call the proximal such joint the PIP joint, and the distal one the DIP joint. That is, after MCP, or metacarpophalangeal joints, are proximal interphalangeal, followed by distal interphalangeal joints. In the unique case of the first digit, also known as the thumb, the MCP joint is followed only by a single IP joint. In other words, the thumb's metacarpophalangeal joint is followed by its interphalangeal joint. Anyway, back to lumbrical function. Job 2 of the lumbricals is to extend at the PIP and DIP joints. The interossei, all I want to say is that they fan the digits out, so that's called abduction, and they also do adduction, getting them back together. And let's just identify the thenar group as this bulge here on the thumb side. I swear I'm not really into palmistry, but this has been referred to as the Mount of Venus. The smaller one on the ulnar side, that is the medial side when we're in anatomic position, is called the hypothenar group. So all 4 of these groups are intrinsic muscles of the hand. By the way, we could have just called them muscles of the hand. After all, that's both where they are located and what they serve to move. And when we do say intrinsic, all we mean by that is to acknowledge that there are also other muscles, extrinsic muscles, located outside of the hand that also have some effect on hand movement. And zooming out again, part of what happens in thoracic outlet syndrome is atrophy of these 4 groups of intrinsic hand muscles. Aside from cervical rib, another way to compress the lower trunk and bring about thoracic outlet syndrome is a Pancoast tumor. This is a carcinoma, which from oncology means malignant epithelial tumor, located in what we call the superior sulcus. So it's at the apex of the lung. You can see that from this position, the effect of a growing mass, so the so-called mass effect of such a Pancoast tumor, it could squish the C8T1 combo, that is the lower trunk. In fact, Pancoast tumors can cause an array of effects by compression of various locoregional structures. One other such effect is called Horner syndrome. Pancoast can do it by compressing the stellate ganglion here. The resultant Horner syndrome has a triad of ptosis, anhidrosis, and I'll pronounce the last one meiosis. In a different order, these 3 are decreased pupil size, drooping eyelid, and decreased sweating on that side of the face. Ptosis is, again, drooping eyelid. Anhidrosis refers to decreased sweating. And meiosis refers to decreased pupil size. The 3 together, Horner syndrome. And let's just note that Pancoast tumor is not the only way to get Horner syndrome. There are several other ways, and you can look over that information another time. Okay, let's tie it all up. There are 4 groups of intrinsic hand muscles. The hypothenar group on the ulnar edge of the palmar face, the thenar group on the radial edge of the palmar face, the interossei and the dorsal interossei do finger abduction, and the palmar interossei are responsible for adduction. And finally, the lumbricals, whose functions are flexion at the MCP joint and extension at both the PIP and DIP joints. There are other effects of thoracic outlet syndrome, but the muscle deficit is atrophy of these intrinsic hand muscles. We can actually cover these other effects by saying that vascular compression in thoracic outlet syndrome would cause ischemia, literally holding back the blood flow, and you can see how that would cause pain, and maybe it makes sense that edema could result as well, problems with drainage. What is getting compressed in thoracic outlet syndrome? Well, the brachial plexus has roots C5, C6, C7, C8, T1. C8 and T1 roots join to form the lower trunk of the brachial plexus. The lower trunk and the subclavian artery pass through the interscalene triangle. If they get compressed along the way, it's called thoracic outlet syndrome. What are some causes of this compression? Well, 1, being born with cervical ribs, or 2, developing an apical lung tumor, which usually fit in this broad category of tumors called non-small cell lung cancers. Apical lung tumor can also be called superior sulcus tumor and can also be called Pancoast tumor. While apical lung tumors can cause thoracic outlet syndrome, they can also cause other effects depending on what they compress. For example, compression of the stellate or star-shaped ganglion, you can get Horner syndrome, which consists of these 3 effects on the face: decreased pupil size, drooping eyelid, and decreased sweating. That is, meiosis, ptosis, and anhidrosis, respectively. Okay, that's it for this one.